this is Lee, licensed acupuncturist and herbalist. Today I'd like to talk about macular degeneration. It's related with aging, but now it started even in 30 years old. So why people get macular degeneration in early age? The circulation to the retina plays important role. And if you have inflammation in your retina, in your macular, then you could develop different type of macular degeneration, and wet macular degeneration and dry macular degeneration. More and more people develop dry macular degeneration, which is related with poor circulation. So the macula does not have sufficient blood flow, and gradually the nerves degenerate. So how can we solve the problems to improve the circulation to your retina? Acupuncture with different kind of technique can have different kind of result. In this new paper in 2017, actually it's not new paper, published in China, they did a randomized controlled trial. They included 110 patients, and there is two groups. There are observation group and there is a control group. The observation group and the control group use the same point. One point is on the medial side of the eyebrow, it's called the bladder tube. The other is behind the ear, called the Yi-Ming. So these 2 points are the main point. And the differences between observation group and the control group are different manipulation of the acupuncture points. On the observation group, they use strong stimulation. They push down the needles and rotate the needles in a much bigger amplitude, while in control group, they only use very gentle stimulation. And the acupuncturist give patients 3 times a week treatments, and it lasted for 3 months. So that's altogether 24 treatment. Then they record how people's vision improved 3 months before and 3 months after the treatment. So before the treatment, the vision were damaged in both groups. And after the 24 treatment, both groups have improved the vision. But for the observation group with a stronger stimulation, the effective rate before right after the treatment is 83%, and interestingly, 3 months later, it's 86.3%. On the other hand, for the control group, the effective rate is around 60%, and the same thing, 3 months later, they can still keep around 67%. So acupuncture has this benefits that it's not only have to improve the vision when you have the treatment, but also 3 months later, this improvement still, the vision is still better than people have the treatment before. And not only that, in this study, they also observed the structure changes. So we have functional changes, you measure the vision, it's improved in both groups. And the structure changes, they measure the macular structure, say if the edema in macular is better. So when you have the inflammation, the fluids will leak out of the blood vessel. So different layers of macula will be swollen. After the treatment, when they measure different layer of macular, actually the different layers are reduced after the treatment. So it's not a functional, not only we can change the function of the macula, but also we can change the structure. But I think during the treatment, people also change their lifestyle, and that's why they stop the treatment for 3 months, and the vision improvement is even slightly higher than the effective rate during the treatment, right after the treatment. So right after the treatment, it's 83.6% in the observation group, and 86.3 3 months later. So changing your lifestyle to reduce the inflammation generally will help you improve the vision and prevent macular degeneration from speeding up when you get to 90 years old. Thank you.